Hello, my name is Sarah Maggio, and today I'm going to be explaining to my patient who has a knowledge deficit how to apply her fentanyl transdermal patch. The learning outcomes and the client outcomes are going to be three different divisions: cognitive, psychomotor, and affective. So the goals for the teaching session will be that the client will verbalize understanding of how to apply the fentanyl transdermal patch and its expected therapeutic effects and potential side effects of what could be coming from the transdermal patch. The psychomotor will be that the client will demonstrate how to apply the fentanyl patch. And then the affective will be that they verbalize that they're confident to be able to do so at home. So I'm going to bring my patient in. Hello, you can come in.
Hi.
Hi. Good, how are you? My name's Daria.
Okay.
I'm going to be your nurse today.
Okay.
And today we're going to be demonstrating and showing you how you can put on your fentanyl patch at home. Are you experiencing any pain today? 0 being no pain and 10 being the worst pain you've ever experienced in your life.
I'm probably at an 8 right now.
Okay, so we'll definitely get that patch on. So the fentanyl patch that you're prescribed is a 25 milligram patch, and we'll send you home with them. There is a few things that we have to go over just because this is a controlled substance, so you want to make sure that you're keeping it out of reach of any pets, children, any other person in your house, really.
Okay.
Do you think that's something you'll be able to do?
Yes, definitely.
Okay. Sounds good. So I'm just going to check this against my medical administration record. Okay, and I'm just going to go pull your meds, and I'll be right back.
Okay, thank you.
Sure. Okay, I have your fentanyl patch. And can you just verify your name and date of birth for me?
It's Cara Maggio, 129, 1971.
Okay, thank you. And I'm just comparing. Have a 25 milligram fentanyl patch that we're going to be applying. Okay, so I'm going to demonstrate it on you first. You just want to make sure that when you're applying the patches, you're always wearing gloves. The fentanyl in it does give a systemic effect, which just means that the medication can go to any part of your body.
Okay.
You don't want to get this anywhere on your hands because you don't want to touch your eyes, and it'll irritate your eyes and nose and everything. So make sure you all have gloves on.
Okay.
And then since this is your first time that you're applying the patch, you don't have to get one removed yet. But when you do, you'll want to rotate the sites so that when you're not causing irritation to your skin.
Okay.
So typically you want to look for an area on the chest that's not hairy so that you don't pull on it.
Okay.
And then also when you're removing the patch, you just want to make sure that you're cleansing the area with like a warm washcloth with a little bit of soap on it so it doesn't have any leftover residue.
Okay.
I would always put gloves on just for that too.
Mm-hmm.
After we put on the patch and then you replicate it, we'll show you how to take it off and dispose of it as well.
Okay.
This is your patch. So because we're in a clinical setting, I'm going to be putting my name, my initials, the time, which is 5:58, and the date, which is April 7th, 2022. It might be a good idea at home also to add the date and the time, just so you know, so you can keep your track for your own record if when you want to replace the patch. Okay, so this is my
Now, how often
patch.
do you replace the patch? Is it going to come with instructions?
It'll come with instructions.
Okay.
Yours, I believe, is once daily
Okay.
or once every 3 days.
Okay.
We're going to put the patch and we're just going to place it right up on your chest on a non-hairy surface. Okay. All right. And then it's on. So then in a little while, about 30 minutes from now, you'll probably start to feel the pain medication effects. And then we can reassess to see if your pain went down from an 8.
Okay. Now, do I have to cover it in the shower, or is it waterproof?
I would say try to aim to shower before you put it on.
Okay.
It can be replaced daily, so
Okay.
You won't have to worry about that.
Okay.
Okay. So then, would you say that showing you and you having you demonstrate it back would be the most effective way of you learning how to do it?
Yeah.
Okay, sounds good. So then I can show you how to remove it, and then we can have you try so that we can see if it's on right. So then for this, you also want to change your gloves. Well, it'll be the next day, so you'll have fresh gloves on, and you're going to hand hygiene, put the new gloves on, and then whenever you're taking off the fentanyl patch, you always want to fold it in so that none of the medicine is going to be touching any part of like a trash can or wherever you're disposing of. You don't want to touch the medicine also.
Okay.
So just try and fold it like this so that no one is going to be exposed to it, and that so it's not on your hands either.
Okay.
And then you'll have to throw it away. At home, it's a little different because you don't have access to dispose of it in a manner that you can't have other people see it. But in the hospital setting, we dispose of it so that it's because it's a controlled substance.
Okay.
All right. So then this is going to be your new patch, and then we're going to have to demonstrate. So do you know the first step for how you're going to do it?
To clean the area.
Yes.
And then first I'm putting gloves on, then I'm going to clean the area.
Mm-hmm.
And then I'll
apply
in the patch. Yeah.
And you're also going to be rotating sites. So if you had a patch on this side, on the left side yesterday, today you're going to have it on the other side. That way there's no skin breakdown or irritation happening. Okay, so here's your gloves.
Mm-hmm. And will I have written instructions just to take home just in case?
Yes, I can provide you
Not that I'll forget.
educational handouts.
You know, when you're in the moment, you forget.
Yes.
Okay.
Here's your patch, and they'll say, we'll just clean it. Okay.
Good to know.
Yes,
Okay.
perfect. Okay, and then you will take the gloves off. Thank you. We'll dispose of those. And then say it's the next day. You're coming in to change another one. Do you remember the next steps then?
To take it off.
Yes.
To put gloves on, take it off, fold it into itself, and dispose of it into a trash can. But make sure that it's not touching anything like the lid or anything.
Yes.
So probably I'll probably end up putting it in a separate bag and tying it up, and then disposing of it.
Yeah, that works.
And then change the site.
Okay, and wash
Move it to a different,
Okay, sounds good. So we can actually practice you doing that.
Okay.
So here's some new gloves.
So, but my other question is, being as it was here the first day,
Yes.
now it's here,
Uh-huh.
can I put it back to where it was in the first place, or should I move it somewhere else?
You can put it back the
closer,
next
or
day on the same side,
Okay.
on the opposite side.
Okay.
We just don't want you to do it 2 times in a row when you're taking one off,
Okay.
and right away placing it back on that same site. That way you can avoid skin breakdown and irritation.
Okay. And then I'll just take it off.
Yes.
And that's it.
Yep, and you can just even roll it in those gloves even, and we can dispose of it.
Okay.
Thank you.
Okay.
And now I do want to go over some side effects that you would maybe experience while using this patch.
Okay.
Have you ever used a patch like this before?
No, never.
Okay.
No.
So you might be experiencing a headache, constipation, dizziness, nausea, vomiting, diarrhea. If you do become shortness of breath, or if you aren't able to catch your breath when you're doing activities or anything, then you should notify your provider immediately or call 911. That could be a sign of respiratory issues. Okay. It's a common adverse reaction that is with the narcotics. Okay. And then you accurately demonstrated disposing of the fentanyl patch. Good. So you understand the therapeutic effects also are that you're going to get pain relief and it's going to help you long term from your acute or chronic pain. Yes. Okay. Yes. Sounds good. All right. And then we're also going to set you up for a 1 month out appointment just to see the side effect or see if the patch is working for you, see if your medication needs to be re-administered or rethought of. So maybe you have to up your dosage, lower your dosage, depending on what you're experiencing. Okay. If you could, maybe even if you're having any side effects, write them down so that way you can bring those to the next appointment to let your physician know. Okay. Otherwise, how do you feel going home? Do you think you'll be able to do this at home?
Yeah, I'm confident I can.
Okay.
Yes.
Sounds good.
Definitely.
Well, I feel comfortable sending you home now. That appointment is scheduled. It's the 7th, so we will schedule your appointment out for May 7th, 2022. Okay. Does that work for you?
Yeah.
Okay.
Yeah.
Sounds good. And then did you have any questions for me otherwise?
I don't think so.
Okay.
No.
Sounds good. Then that was it. It was very nice to see you today.
You too. Thank you.
Have a good one.
Nice meeting you.
Nice meeting you.
Bye-bye.